Hi, I'm Annie Sleece, and I'm on the staff at NAMI Delaware. This is part of a discussion series focused on back-to-school community resources. We're talking with state agencies who work to support youth and families in Delaware. But before we begin, we'd like to give you a little background on NAMI Delaware. NAMI stands for National Alliance on Mental Illness. We are the Delaware chapter of the national organization, which is the largest grassroots mental health organization in the country. There are NAMIs in every state and hundreds of them across the country. And if you are viewing this video outside of Delaware, you can find your local NAMI by visiting their website at nami.org. NAMI Delaware offers support, education, and advocacy to those affected by mental illness. And not only just those who are diagnosed, but also those who care for them. You can learn more about our organization by visiting our website. And there you can also learn about other mental health related resources in Delaware. Just click the Education tab and select Resources. Now, NAMI Delaware is not a crisis response agency, but today, before we start our conversation, we want to make sure that you have access to support should you need it at any time. There are many ways to find that information, but here are just a couple. Delaware offers a Hope line that's available 24/7, and also the National Crisis Text Line 741-741. And of course, today we'll hear a little bit more about a crisis resource for youth and families. So I'd like to welcome our guests, Malia Boone and Shayna Powell from Delaware Guidance.
Hello.
Hi. Thanks for being here. This is such a busy time. I'm so glad you were able to join us for just a few minutes. Can you share a little bit about your job title at Delaware Guidance and maybe a little bit about the background you have and what brought you to Delaware Guidance?
Sure. I'll go first. Hello, everyone. My name is Malia Boone. I'm a licensed professional counselor of mental health. I'm also the program manager for the crisis program at Delaware Guidance. So we provide risk assessment and follow-up crisis intervention service for children and youth across the state of Delaware. I've been at Delaware Guidance for about 16 years, and I've been a part of the crisis program for most of those years. And I've also done some outpatient counseling and family-based services and things like that. But I think that I'm very passionate about working in the field of crisis, and I really love to help families through some of the challenges that they go through when it comes to crises that might occur. So I plan to probably be here forever.
Oh, that's great. And that's good for us to know that too. We're going to hold you to that, Malia. Thank you.
Okay.
All right, Shayna.
All right. My name is Shayna Powell. I am the Specialized Clinical Services Program Manager. Honestly, I came to Delaware Guidance. I used to drive by and I would see the building and I thought, I want to work there someday. And I was very fortunate. I submitted my application when I was a new graduate with a bachelor's degree. And that sort of started my career here. So I've worked in a few of our programs. We previously had a day treatment program that I was a part of. I've also worked in our crisis program. I've worked in our outpatient program. And right now what I do is a lot of work with schools. So we set up contracts with schools to provide mental health supports. And we work really hard to tailor our contracts to what the school needs, because every school and every district is so different and the student needs are different. So I really try to understand what each school's needs are and then how we can provide support for their students in that population.
That's great. I'm so glad to hear that. And coming from a former teacher, myself, I was a former teacher, I can tell you, you're right. Every school does operate differently. They have different needs. So it's great to hear that you look at that as you build your contracts. So speaking of schools, it is back to school time again. The third year that COVID will be a part of a school year. So that's hard to believe, isn't it?
Yeah,
So it's been 18 months, and I'm sure that COVID, like it's affected us all, I'm sure that it's affected the work you're doing at Delaware Guidance. Would you like to address sort of some of the things that might have changed, or maybe new programs, anything like that?
Sure. For the crisis service, there's been lots of different changes. We've done some telehealth, which we've never done ever in the history of the crisis service. just to make sure that we're continuing to be able to provide support to children and youth in crisis, even if there is a concern about COVID or just keeping everyone, including families, schools, staff, everyone safe. We continue to have some telehealth availability and some in-person availability. So depending on the needs of everyone involved, as well as our staffing and the health and wellness of the families and schools and wherever we go, because we go to multiple locations. So that's been a shift in our delivery of services because of COVID, which in some ways has been good, because there are sometimes families really don't necessarily want us to come to their home. And this is another opportunity we haven't had before, which can be helpful in some situations. And also we had a change in the request for services throughout COVID. There's been significant decline at the beginning of COVID, mainly because a lot of our referrals come from the school initially, and the schools weren't seeing kids in the school building, so we had fewer requests for services. And then as kind of things got a little bit more normalized, we had an increase in the calls, but still not totally up to where we would have been previously when kids were fully in the building. So it's interesting to think about what this school year will.
Right. It is interesting, and to be able to look back at all 3 years over time and look at that data, that would be an interesting visual for sure. Thank you. Shayna, did you have anything to add as far as the pandemic related changes?
Yeah, I would echo all of the same sentiments. The pandemic was interesting because it took us also off guard, right? Mm-hmm. And then we had to figure out what we needed to do to be able to accommodate families. And like Malia was saying, we pivoted pretty quickly. We were really lucky. Our leadership team was really proactive, and we were able to get laptops into the hands of every single clinician in the agency in a relatively short period of time, so that we weren't disrupting services to the families. So that was really incredible to see. And then our next step was sort of figuring out how do we prepare for what we think is going to be a surge of people looking for services, because we know so many people are impacted by the pandemic. But then the opposite kind of happened. It got really quiet, and that was concerning because we knew that families were still struggling. We knew that the calls that were coming into the crisis center were more intense and more severe than what we were seeing previously, and we were having trouble connecting with either students or families reaching out to us. So we really had to figure out how to reach them. Like, how do we get our information to them so that they know we're here and we're ready? And so we had to do some things differently than we had done before. And that was just a lot of communicating information about who we are, where we are, what we do, what we're available to do. If, say schools weren't quite sure how they were going to reach their students, we wanted to be prepared once they started connecting with all of the families again, that they knew they could come to us. So it was a lot of communication initially. And as we enter into the new school year, there are still lots of unknowns, because how will the kids transition back to school? And so we want families to know that we're prepared for that as well. We are ready to see kids. We have availability. We want all families and schools to know that there are supports available during this transition period, and then of course beyond.
Oh, that's good. That's really good to hear. And that's really one of the reasons we're doing this video series, because we want to make sure families and youth serving professionals have that information and they know how to reach you. So we will share contact information. That's coming soon. But let's dive deeper into the school programming, or the programming that you offer, Shayna, and you and your team. What would families expect? What should they know? And then what should schools know?
Sure. So we have, from our school-based perspective, a couple of different services that we're able to offer. One of our services is we call it like a satellite clinic, and that's really where we take an outpatient therapist from our office. We partner with a school who's willing to give us a little bit of space and provide us with referrals for kids that may need to be seen for treatment. And that partnership is really nice because it eliminates some of the barriers for the parent, right? Like if we're traveling to the student, we can see them right in the school. It makes it a little bit easier for them. It's no cost to the school, otherwise, other than a little bit of space.
That's a good point to make.
Connect with the student. And I think one thing that it's important for parents to understand is that even though we're partnered with the school, everything is confidential, right? So we are not sharing information with the school unless the parent explicitly gives us permission to be able to share that information. So we're not running to the teacher or the administration and saying, here's what happened in therapy today. Look out for these things. It's very transparent. We're always asking for permission to be able to share information, unless, of course, there's a risk of the child hurting themselves or hurting someone else, in which case we would contact the parent immediately so we could put together a plan to make sure that that child stays safe. Sure. The other service that we offer is clinical consultation. And so this is where we're partnering directly with the school again, but the service is geared towards generally the entire student population. So what we're doing is we're assigning a clinician to that school, and this is where the tailoring comes in. They can work with the administration and the teachers and the students to design mental health programming that meets the needs of that specific population. This is great that schools are seeing the need and they want to make sure that they have staff in the building that are able to assist with these kinds of things. And again, this is now is free for parents. So the school is saying, we recognize this need. We want to make sure we have the support in the building. And so they provide the funding for that.
That's fantastic.
So those are kind of your two big categories.
Yeah, sure. And I hope that's, answering some questions that viewers might have. So when it comes to reaching out and finding help, there are some things I think that NAMI Delaware certainly hears from families. One of them is, how do you pick who to see? Like, what do you say? How are you sure you found the right one? And then the other thing is, when there's a waiting list, what do you do?
Yeah, I think if parents can use their resources first and foremost, right? So if there's a connection with the school, they feel comfortable going to the school counselor. They're a wealth of information usually of what's available in the immediate community. And what they can do is get a referral list together maybe, or they've had experience with local providers and they can say, one family had experience with this therapist and it was great. I highly recommend them. So starting to gather resources from that perspective. A lot of schools are also adding mental health supports, new to some schools, but some districts have been doing this for many years, where they have licensed social workers and licensed counselors right in the school that can provide a little bit of assessment, maybe some interventions for symptoms that are a little bit milder, but then also connecting them to resources in the community if they need something a little more intensive than what the school can provide. My second recommendation would be checking the back of your insurance card. There's usually a number on the back that you can call and they can let you know who is in network. And so you can start researching or start calling around to see the availability for these professionals to be able to get in and get an appointment. And insurance is also not a limiting factor. So here at DGS, we see all children regardless of their ability to pay. So if for some reason a child is uninsured or underinsured, we can still see them here in our office. That's not a barrier to treatment for us.
That's a really good point. That's definitely a good point. All right, well, let me ask Malia a question now. You've been sitting so quietly. I feel like it's your turn. Your work is around crisis, and I think it's a really important conversation and one that people are really kind of fearful of even having. Yeah. So what can you share when it comes to addressing youth and families and when to call and what kinds of circumstances and that kind of thing?
Sure. So I think first and foremost, it's so important for us to remind families. I know we've done this in other videos about crisis, but there is no specific reason that you need in order to call and access crisis services. If you feel that your child is struggling, if a child feels that they're struggling and want to reach out, there's no criteria to be met. It's just that you're having a hard time, that you feel like you need support. Crisis services provides like immediate access to that support. And, I think the other thing that's important to understand is when you seek out support from crisis, we are going to do a risk assessment. So that is part of the process, and that can be confusing. Sometimes we do have families that maybe reach out because they're struggling with de-escalation in the home and they're not sure how to go about, helping their child calm down, helping them regulate. So they'll reach out to Crisis for assistance, and we will definitely assist with that. But we'll also complete a risk assessment because that's part of the process. Knowing that they're having a hard time, we want to make sure we have the full picture about what is going on, what they're struggling with, how we can help, and what supports need to be in place to help them. We'll create a safety plan. We'll create a treatment plan for at least if we're opening the 30 days to provide support. We'll make sure we have a plan in place that we collaboratively put together with the family to decide what is it that this child needs in particular. What does the family need to be best supported to address these kind of escalations or whatever the crisis situation may be, and then also helping them connect to the different resources. Now, of course, we are a part of Delaware Guidance Services, but we provide them a full resource list to all different places in the community that they can choose from. We'll talk through the experiences we've had with different agencies, what might be the best match for them in terms of the treatment services that may be needed at that time. We might look at there may be a need for a higher level of care or something like that that could be offered, and we'll assist them with connecting to those services as well. So I think like the crisis program can be an excellent resource for families, not only when there's a major crisis going on, like when a child is feeling suicidal or feeling even like they want to kill someone, or getting to the point where there's like fire setting behaviors or sexually inappropriate behaviors or substance use. There may be many different things that could be considered a crisis, but even just when they're struggling to figure out how to cope with anxieties, school refusal, we see that a lot when the school year starts, that children are struggling going back to school. I expect to see that probably more this year than we have even before. This transition is probably going to be challenging for a lot of children. So I think that there's so many different reasons. There needs to be no criteria. And then additionally, in terms of what Shayna already mentioned, there is no requirement for insurance. Any child can access crisis services, no matter if they have private insurance, Medicaid, or no insurance. The only thing that is important for families to know is if they clearly feel their child needs psychiatric inpatient hospitalization and they have private insurance, they can go directly to the facility that they'd like the hospitalization to occur at to complete an assessment there. They don't have to use the crisis service, but we often are a resource to private insurance families who would like to have someone kind of walk through it with them, kind of do the assessment, figure out maybe they're not sure that they want psychiatric inpatient. Like that's a big decision to be made that we can collaborate with the family, talk about what the concerns might be or how we could potentially keep the child safe in the community, or maybe that this might be the best course of action. So I think ultimately, I just would love families to know that we are a resource to them. We can certainly walk them through when they're in their toughest times and try to help guide them. And that's what I always hope for, getting feedback from people. I hope that that's what they feel when they receive services from us.
Yeah, absolutely. I think the key takeaway for me hearing you speak just now is really the family defines the crisis.
Yes, absolutely.
The family says this is a crisis in our household.
Right.
And I can, speaking as a parent myself, speaking as a family member who didn't know of these services, I can tell you, even if I had known, I'm not sure I would have felt like I could call. I probably would have wondered, is this serious enough? And it sounds like you're saying it's always serious enough if you think it is.
Absolutely.
Which is really, really important. Well, I am so glad we had a chance to talk. I know we have not come anywhere near covering all the things that you do at Delaware Guidance. So if there are viewers right now who might be working in schools, or maybe families who have young people and they want to get connected to the services, but they're not in crisis, are there good ways to reach you?
Yeah, there's lots of ways to reach us. You can definitely reach us on our website, and that's www.delawareguidance.org. For schools that might want to think about setting up a satellite clinic, or mental health programming with one of our clinicians, they can reach out to me directly, and that's spowell@delawareguidance.org.
That's great. Thank you. And then, of course, for families who are experiencing a crisis, and remember, you are defining that. How would you? How will they reach them, Malia? How will they reach
So
you?
we have a toll-free crisis number that's available 24/7, 365 days a year, even on Christmas. So if you're in a crisis any day, you can call the crisis hotline at 1-800-969-4357, and 4357 spells help, if that's easier to remember.
That's great. That's good to know. All right, before we wrap up, I've been asking the same question from all our guests in this series. I'm asking if you had a chance to speak with anybody supporting young people right now as they begin their back to school season. As I said before, it's the third year of COVID affecting a school year. Yeah. Do you have any messages for them? A message for family caregivers, educators, anyone in this work?
Yeah. So I think for me, I've seen so many different experiences that children and families have had throughout the last couple of years of COVID in schools. And I see a lot of resilience in families and children. And of course, we struggle. This is a huge change in our lives, right? All of us. We all are experiencing a huge change in our lives, the way we go about our daily lives. But at the same time, I've seen so many people adapt and do amazingly well. Sometimes you need a little bit of support to get through that change. And that is all of us. We all need a little bit of support and a little helping hand. So I think it's important for us to remember that, it's okay to ask for help if we're struggling. It's okay to say, this is more than I can handle right now. I have so much. Reach out to the crisis service, reach out to counseling services where we can talk through whatever those struggles may be and help guide you and help you work through what you want to do, what's going to work best for you and your family. There's no problem with asking for that help. And I think we all are kind of doing that. So don't feel alone if you feel like you are somebody who needs to ask for help. A lot of us are asking for help right now, and please don't feel like you shouldn't do that. This is a great time to do it. There's a lot of resources out there.
That's right. Shayna, do you have any thoughts?
Yes. So my message for everyone would be to give yourself a lot of grace. It's been different for so long, and it's going to be different going back to some of the things that we used to do. And that's okay. I think we don't need to have expectations right now. The only expectation is that you take care of yourself, because you are the most important thing, or your family is the most important thing, and really leaning heavily on relationships right now, whether that's relationships at work or relationships with friends or family, whoever that is. I think that's where our strength is right now, is in each other and leaning on each other. And the other stuff will come in time. It always does, right? As long as we are together and we're united, then we'll be able to get back to some of the other things that we're used to doing.
That's great. Oh my gosh. Thank you so much for being with us today and for sharing such important work that you're doing with Delaware Guidance. We hope that you'll come back and we can talk more.
Of course.
Thank you very much.
All right. Thanks so much. Bye-bye.
Bye.